Good morning. We're here at the inaugural of United Clinics, United Hospital with Dr. Koteswara Rao. Good morning, Doctor.
Good morning, ma'am. Thank you for visiting us and consenting to inaugurate our clinics.
My pleasure.
And United Hospitals aims to bring about a paradigm shift in the quality of healthcare in India. And the first facility which we have started is this multi-specialty clinics. And the group is actually promoted by doctors,
Yes.
many of whom are Western trained, with the aim of providing high quality healthcare. This clinic, we have about 12 doctors working with us and have various specialties from general medicine, cardiology, diabetology, gynecology, we have ophthalmology, and then we also have a full-time clinical biochemist and a pathologist.
That's wonderful. All under one roof.
Under one roof.
Wonderful.
And we do also have a radiologist who does ultrasounds and reports on various kinds of x-rays.
That's really nice. You took us on a tour of the diagnostics. Maybe you could tell us a little bit about the diagnostic specialties that
Yes,
you
ma'am.
offer.
What we realize at United Hospitals is that diagnostics play a very important role in managing patients' illnesses. And we have invested in the state-of-the-art quality equipment so that we could give patients the most accurate reports and in quick time. As you're probably aware, in Hyderabad, reports usually take a day or two, then they shouldn't. And so we are making a conscious effort to give most reports within 2 hours.
Wonderful. That's really nice. And the diabetes clinic is run by
Dr. Indira.
Dr. Indira, yes. So will you say a bit about the diabetes?
Sure, ma'am.
clinic?
Dr. Indira is a medical practitioner with over 35 years of clinical experience, and she's very passionate about diabetes and about diabetes in women in particular.
Okay.
Because as you are probably aware, many women health-related issues are underdiagnosed, under-recognized, as a result of which they have worse outcomes compared to men, which is patently unfair. And so we are making a conscious effort to reach out into the community and pick up the pre-diabetic patients when the intervention needs to start, so as to enable better long-term outcomes, reduce the complication rates.
Wonderful. You are a very renowned cardiologist yourself, and I know you've been treating my father-in-law as well.
Thank you.
So, what are the cardiology provisions in your hospital?
Right now in this clinic, we have the non-invasive facilities. That is, we have facilities for ECG, treadmill tests, and echocardiography.
Okay.
And we do all kinds of echocardiography, and we also have a cardiologist who specializes in non-invasive cardiology, who's heading that department. And once the hospital starts, we will have 2 cath labs, and we also have a fully equipped coronary care unit, and we have 3 operating rooms for cardiac surgery. So we will have a full-fledged cardiac department.
Wonderful.
And that will be one of the main areas of focus.
Okay.
Because as you're aware, cardiovascular disease, incidence of cardiovascular disease has been rising steeply in India.
Right.
And unfortunately, us Indians have very poor outcomes compared to Caucasians.
Right.
So we want to focus on better management of cardiac patients and take it a step further and look at preventive cardiology as well.
Okay. So, you have practiced in England, right? So, what is the difference in your from other hospitals in India that your hospital is going to provide, bringing that experience of England
Yes,
into
ma'am.
Indian healthcare?
Most hospitals now in all the major metros are very well equipped in terms of facilities like cath labs with coronary cares and other pieces of equipment which most cardiologists use. But where we want to make a difference is looking first into preventive cardiology, then also to look at cardiac rehab. Patients who have a bypass or have undergone a heart attack or had a stent put in, there is a period of rehab which needs to be looked into, and they have to be guided through that period.
Okay.
So we want to focus on having a rehab program so that they can be brought back into their regular professional life as quickly as possible with as minimum complications. So these are 2 areas which you certainly want to focus, apart from doing the usual bypass surgeries and angioplasties.
Right. Well, I'm delighted to hear about all this, doctor, and I wish you all the very best and a grand success, and I'm really happy to be here this morning.
Thank you very much, ma'am, for your kind words and for graciously consenting, and we are extremely pleased, and may I thank you on behalf of all my staff and myself for having consented to be here and spending so much time with us.
My pleasure.
Thank you very much.